So I think what was really interesting for us is it's the first time we've been involved in such a large research study. So the number of people involved, from clinicians through to patient support staff, to the patients themselves, to our primary care and secondary care colleagues. It was just a very different experience, and I think there were a lot of challenges that came with that, but it was really interesting to be part of, and very interesting to see the actual results come out at the end, which is the whole reason why we applied in the first place. We wanted to understand the benefits of telehealth and telecare, what they would do for patients, what it would do for our primary care colleagues, our secondary care colleagues, and we've now started to see some of those results come out to substantiate some of those the feelings that we had, really. I mean, we weren't able to do our own local evaluation, so we've had to use the national results, and we haven't seen the specific results for Cornwall. But obviously the results that were coming back around non-elective admission savings, the I think it's 20% or 21%, the mortality rates, they're all very impressive figures. What we've seen as well is, for our own local evaluation that we've done retrospectively, is we've really tried to focus on what does it mean for patients. And we've done some recent survey results around that, which is showing that some really positive findings around 90+% feel it's giving them benefit. And we've really started to delve into the detail around that as well, to understand it in a bit more robust way. It's moved on quite a great deal. We're still focused on COPD, diabetes and heart failure, but we're now expanding the service. So we've installed over 1,500 people in the last 3 years, both in Cornwall, in North Devon and Torbay. So we've expanded outside of the county. And now we're focusing on other conditions as well, and we're one of the first organisations to be able to do that. So we're looking at things like urinary tract infections, those at risk of falling, two of the key areas that we're focused on, and others, because what we don't want to do is, if you like, just think about the three main conditions. There are benefits that could potentially be out there for other people, and we need to explore that. I think that the feelings that are out there, both from patients and from clinicians out there, are going to be mixed. I think from our patient perspective and the work that we've done, and from them looking at the studies and our own questionnaires, we know that our patients really, really value telehealth. I think from a clinical perspective, particularly for those in primary care, seeing the results of WSD is given mixed opinion. Because the results were mixed. There's some very, very positive things in there, and there's some things that aren't as conclusive. And I think that's what's dividing opinion at the moment. And what I would like to see as part of further research is to plug some of those gaps, so that we can understand where telehealth should be focused and where it shouldn't be, because for some people it isn't necessarily going to be appropriate, isn't necessarily going to work. Our experience certainly is that for some people it really does, and that we need to focus more on those people and recruit more of those type of people into the service. I think, as I was mentioning through the presentations that we've done today and the discussion that we've just had, that it's really focused, for me, needs to be on the front line, for those people that are actually going to make decisions. So the commissioners, now we have a brave new world in terms of the way that healthcare will be commissioned, with new structures within primary care. We need to have researchers really focused on those groups, so that they can make decisions about funding. But we also need to really factor in the patients, because that's what it's all about. It's about patient care. So what is it that we need to understand about the benefits for patients, and really build that into the studies, so when we're coming back with the information and the results, it means something to those people that have got to make decisions. So commissioners, suppliers in terms of telehealth and telecare suppliers, patients, all of those stakeholders need to be thought about through the evaluation process.